What are the biggest inequalities in the U.S. healthcare system, and which communities are the most vulnerable here?
At the end of the day, there usually is rarely a funding opportunity to pay for my people's health care. So you figure it out. We MacGyver the thing. We take paper clips and duct tape and, and we try our best to take care of our people off the excess or whatever's left over. You have people out here solving life's most intractable problems: homelessness, education problems, the justice system, people working to support all these folks. When tragedy comes, who do they look to? The nonprofit sector, right? But then those same people who are caring for everybody else don't get care for themselves. So we said, you know what? We're going to build something that takes care of people who take care of people. And by demonstrating that we can do that particularly well, it makes a greater statement and even a policy statement about how we can now use preventative health care to take care of all of us. There's a system where it's not adversarial. It's the people versus the employer, or the big insurance versus little insurance, or this versus that. We can actually create a system where everybody is well taken care of from every single angle. And that's what we're focusing on right now with Arretae.
Okay, so we're going to just go here.
Yeah.
We're just going to just take.
Go ahead, bro. Dive in.
We're going to take the bandages off. We're going to take all that, the Band-Aid off. Now, with Arretae, your vision, I understand, is to put people and prioritize people over bureaucracy.
Yeah.
Right? Preventative health care, leverage technology in the biotech space and such forth.
That's right.
What's wrong with the healthcare? We went there a little bit.
Yeah.
But yeah, since we talked about this last.
I'm going to tell you. So right now, we're in a world where healthcare in America, we spend more per capita than most developed countries. Yet we have some of the most mediocre results because our healthcare system isn't truly a healthcare system. What we have is a sick care system. So here are some facts, plain facts about it. The latest biotech innovations, or any innovations, whether we're talking about in the pharmaceutical space, or the biotech space, 70% of the innovations in the healthcare space within the last 5 years are not readily accessible to the average person. And it's because 77% of people are not going to take or not going to consume a healthcare service or solution unless their insurance pays for it. But the way that we're built right now is insurance prioritizes lower cost solutions to take care of a sickness after it's been diagnosed, right? And that means that there are going to be many things that you have to take or try before we'll get to the latest and greatest. That means that, yes, we are going to prioritize generics, or maybe something that was approved by the FDA, but it was approved by the FDA maybe a decade ago.